Remember what we are discussing is public participation. So in the context of public participation, you're already good to go?
Yes.
So how do you effectively engage them to ensure their inclusion?
We, as a commission, we are required to do public participation by informing the stakeholders what the commission is doing, by also consulting them, getting their feedback in the various programs that the commission might want to implement, involving them also, and collaborating with them as equal partners for achievement of the Commission's mandate, shared Commission's mandate, and that is towards credible elections that is fair and transparent to all Kenyans.
If members of the public are to effectively participate in public participation with the IEBC, what is the key ingredient for an effective discussion that they should have?
They should have knowledge they should have knowledge on their rights, what the law says. They should also have the skill itself to be able to participate, and they should also have values. Which kind of leaders might they want to, choose for themselves? So those are some of the ingredients.
Where and when does the public get access to electoral knowledge? The knowledge you're saying is specific to elections, isn't it? And boundaries delimitation. So where would they get this information and how?
They will get this information through the Commission. The Commission will organize for engagements, public barassas, campaigns, media, so that the members of the public can get this information.
So the start point of the engagement is civic education, isn't it?
Yes.
Thank
you. Okay. I want to welcome Nicodemus Bore to ask some questions.
Thank you, Chair. James, in your CV, you've stated that you're a manager of Social Health Authority.
Yes.
And your role has been to ensure the seamless rollout of the Social Health Authority provider portal system.
Yes.
I'm sure you have experienced what the public have heard and talked about the SHA program of government. And there are good lessons you have picked from that. Can you give us a few of the lessons that you have picked from the Social Health Authority program that you can bring on board as an IEBC member?
Thank you, Mr. Nicodemus. And just like IEBC, the Social Health Authority is highly digitized. And the digitization comes with the responsibility by the organization to engage with the stakeholders, that is the healthcare providers and the people of Kenya. Some of the lessons that I've learned that are more desirable to IEBC as well is the need for information. There is a lot of misinformation peddled when the program was being initiated that is not correct. Until the institution dissects it and demystifies, that is when, the public can appreciate. Just like IEBC, there are quite a number of steps that are digitized within the Commission, like the voter registration, voting itself, results transmission from polling stations to the National Tallying Center. The kind of perceptions that are there is what we've, I've also encountered myself, because at one hand, patients are getting services, Kenyans are getting services. On the other hand, there is misinformation about the program. So what is very, very important is for the institution to engage with the stakeholders continuously, be able to demystify these particular programs that we are running. So yes, I have the skills, I have the experience to bring to IBC in terms of demystifying the programs of IBC. Yes.
Now, looking at the SHARP program and the IBC, and you bring the two together, and we have tried to compare the two, yet SHA is fully digitized in terms of services and provisions. IBC is half digitized. The only area that maybe they use digital is registration and identification of voters during voting. Do you think that there is a possibility that eventually IBC should be fully digitized?
Thank you, Mr. Nicodemus. Personally, I come from an environment where digitization is very high. And one of the advantages of digitization is there is less interference of data by human beings or staff. And those are some of the areas that the developers of the program, as internal stakeholders, have also added our voice to the same. So our systems are end-to-end. When a member goes for registration, that is the same information you will get the day you will need to seek for service. And once you are logged into the system at the point of service, the information doesn't change in between. And in the process, there are so many other enhancements up to a point that the healthcare provider is being reimbursed for services they offer to that particular member. So when you look at the current status of IBC, the programs are not fully digitized. Even the process of voter registration, for example, you get a clerk taking information in a manual form. You don't know whether the form will be keyed into the system at the constituency level or at the IBC headquarters. So these are some of the things that I will wish to look at when I get to be appointed as a commissioner. So starting from registration, from the SHA perspective, we are linked to the registrar of persons. So even the registration itself, you just need to key in your ID, and then the entire information about the member is fetched from that particular system. So it reduces issues of double registration or impersonations when a person goes to the hospital. So even IBC needs to be linked to this particular system of registrar of persons, so that we don't have issues of dead voters still in the register. We have issues of double registrations. We have members that have been moved from one polling station to another without their knowledge. And another issue is about the voting day itself, the day of heavy lifting by the commission. The process should also be as digitized as possible to be able to prevent this kind of double voting, for example. Yes.